I'm a level 1 nursing student, level 2. My clinical instructor has assigned me to observe you today.
Excellent. Feel free to ask any questions you might have.
Thank you so much. I look forward to learning a lot. So you're taking care of the patient in room 618. Do you have time to give me a report?
Yes. The patient is Carl Rogers. He's a 67-year-old African-American male. He's a type 1 diabetic. He has no known allergies, and his doctor is Dr. Phillips. He's a full code. He came in complaining that he's had elevated blood glucose levels for the past few days in the 300 range. He has a relatively large diabetic pressure ulcer on his right heel. He's alert and oriented ×3. He has a history of hypertension, but he's stable as of about an hour or two ago, and his blood pressure was 128/70. He has a pain level of 1. He has tingling in his bilateral extremities, lower bilateral extremities, and that is progressively worsening. He wears glasses, he has a steady gait, his lungs are clear, he is on a diabetic, reduced calorie and reduced sodium diet. His last urinary output was 320 milliliters. He has a vein open in his right forearm, and he is on several medications. He's on Simvastatin, Neurontin, NPH and regular insulin, Lispro, gabapentin, hydrochlorothiazide, and PRN morphine for pain.
Okay.
This patient has a medication, Lispro. It's also known as Humalog, and that's due soon.
Okay, thank you so much for giving me a report. Do you mind if I ask you a couple of questions regarding the med administration, then watch you demonstrate giving the med in the patient's room?
No problem at all. What questions do you have?
Why specifically is this client receiving this medication, and what action does the medication have on the body?
He's taking this medication to control his hypoglycemia. It acts on the body by lowering blood glucose levels by stimulating glucose uptake in skeletal muscle and fat.
Oh. When should you question administering the medication? Does the medication have a therapeutic serum level? And which vital signs must be monitored? What physiological parameters should be monitored when the medication is being administered?
Okay, well, there's no therapeutic serum level for insulin. It must be given within 15 minutes of the patient eating, so typically you want to make sure that their food is right in front of them. You would not give the medication if the patient is NPO, and you would hold it if there are any signs or symptoms of hypoglycemia, if the blood glucose level is under 70. Also, because it's given on a sliding scale, if his blood sugar is normal, we probably would not give this as well. We're going to monitor changes in weight. And since his last blood glucose reading was 290, we're going to give him 6 units today.
Okay. What are the side effects and potential adverse reactions?
Yeah.
Sorry, what interventions must be taught to the client to ensure the medication is administered safely in the hospital setting, and what interventions must be taught for taking the medication safely at home?
We're going to teach the client, make sure he's aware of the signs and symptoms of hypoglycemia, which are cold, clammy skin, feeling shaky, increased hunger, tingling feeling, headaches, slurred speech, blurred vision. We'll make sure he's aware of what those symptoms are, and we'll also make sure that he knows how and when to administer the insulin. We're going to check the blood glucose before administering it, and we're only going to give it to him if a meal is available. We're also going to make sure that the client is aware that he needs to be carrying a source of sugar with him at all times in case of hypoglycemia, and he should be wearing a med alert bracelet.
Okay. What are the side effects of potential adverse reactions?
There's rare instances of anaphylaxis. It's truly rare for there to be an insulin allergy. Hypoglycemia is the main one you have to look out for, and there could be swelling and redness at the injection site.
How will you know the medication is effective?
His blood glucose will be within normal range without episodes of hyperglycemia and hypoglycemia.
Okay.
Any more questions for me before we go in and administer the patient their medication?
No, thank you for answering my questions.
You're welcome. No, not a problem at all. It's important to know your patient and the medication you're administering to keep your patient safe. Pause it.
Okay, go.
Knock, knock.
Come in.
Hello, my name is Melissa. I'm your nurse today. I have a nursing student with me, Rachel.
Hello.
Hi. We're here to administer your insulin.
Okay.
You have your breakfast. That's great. Well, actually, it's probably more like your dinner because it's 17 p.m. Yes. Okay. Wash my hands with my gloves on. Can you give me your name and date of birth, please?
Carl Rogers, I'm 67.
Okay, great. And do you have any allergies?
Nope.
All right. Have you had any lightheadedness, tingling, any feelings of shakiness or being cold, clammy?
No, no.
Okay. All right then. Let's go ahead and scan your heartbeat. Did not work. There we go. We're going to get the injection in your upper arm. Is that okay?
It's fine.
Just make sure this is correct. His blood glucose was 290. So if we look at the scale here, it says that he needs 6 units of insulin. Okay. So we're going to draw up that insulin. We'll pretend this cap is off. We're going to inject 6 units of air. And then we're going to flip the vial over and pull out our 6 units. Okay. And I guess we're going to just take an alcohol pad. Okay. And then clean off the site that she's not really wearing clothing here. And pinch the skin. And then we're going to administer at a 90-degree angle. Okay? Very good. And then retract the needle and dispose of it in the sharps container. Done. Okay. And now we're going to chart what time we gave it. There's not any writing here.
Just don't take your time.
And we did that in the right upper arm. Okay, and then I'm going to put my initials in. Okay, Mr. Rogers. The insulin will take effect in about 30 minutes to 3 hours, so we'll be back to check on you within that time. If for any reason you feel a little lightheaded or shaky or develop a headache or anything like that, please give us a call. We'll be calling. Do you have any questions?
No.
All right. All right, very good. Thank you so much.
Awesome. Thank you so much for demonstrating a safe medication administration. I just have a couple more questions for you if you don't mind.
Sure.
Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, we checked the blood glucose, and then we verified in the MAR how many units of insulin this client was supposed to receive. And then we also asked the client and observed the client for signs and symptoms of hypoglycemia.
Okay. Did this information affect your decision to administer the medication?
Not today.
Thank you so much for answering all my questions. I really feel like I understand it so much better.
Great. Again, not a problem at all. I'm always here if you have any questions or need anything. I'm going to take some time now and document the teaching I provided to the patient and any other things I did in the patient's room. Do you want to observe me documenting as well?
Sure. I'd love to watch. Thank you.